Welcome to the SBIRT training for nurse practitioners across the lifespan case scenario series. This project was supported in part by funds from the Center for Substance Abuse Treatment, Substance Abuse and Mental Health Services Administration, the Department of Health and Human Services, under the grant SBIRT Training for Nurse Practitioners Across the Lifespan. The information or content and conclusions are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by the Center for Substance Abuse Treatment, SAMHSA, the DHHS, or the U.S. government. The authors have no conflicts of interest, and we hope you find this series of case scenarios educational and useful in your practice. Diane Smith is a 45-year-old Caucasian female presenting with severe lower back pain. She was prescribed oxycodone several months ago following back surgery. She recently took some of her leftover oxycodone following an injury after a fall. She is especially worried about losing her job as it requires a significant amount of physical activity. The objective of this case vignette is to compare and contrast two approaches to screening and intervening with a patient who is using opioids. While watching this first vignette, please note areas for improvement.
Hi Diane, my name is Braden Kamig. I'm a nurse practitioner student, so I'll be working with you today. So I understand you're here for low back pain.
Yeah, I hurt my back again. I was out Friday night and I fell and landed on my back, and it's really killing me. I think I've heard it worse than before. I had some leftover oxycodone and I was in a lot of pain. It was like 10 out of 10, so I did take a few of those, but I really just wanted to wait to see you.
So it sounds like you relapsed on the opioids then?
Yeah, I guess, yeah.
Okay. Well, I understand that your pain is pretty troubling, but we can't have you taking, the OxyContin anymore. We need you to stick with Advil. Have you tried that?
Well, I did try some on Friday night when it happened, but it really didn't help, so that's why I took some. I didn't think I was going to make it through the weekend.
Okay, yeah, it's really important that we try to eliminate those. We had you do, it's called the drug abuse screening test. We give it to all of our patients. You scored a 4 on that, which is a little bit problematic, so we really need to eliminate those kind of medications and just use Advil or Tylenol. I'm just a little bit concerned about your score on that. That's kind of an issue.
Right, well, I'm almost out of my disability, and my husband's laid off, so I'm going to have to go back to work soon, and I'm just worried that that's not going to be enough.
Yeah, I just really can't prescribe you anything stronger than the Tylenol or ibuprofen right now.
Right. Yeah, I didn't go to the ER because I didn't want them to think I was like drug seeking, but I just didn't, I didn't know really what to do.
Yeah, we'll have to stick with the anti-inflammatories for now and see how things go.
Do you think that's going to be enough?
I hope it is, but we'll have to see.
Okay.
Hi, Ms. Smith. My name's Mike. I'm one of Braden's instructors, and I wanted to thank you for allowing her to take part in your care day, doing your assessment. Sure. How do you think things went? How did you feel?
Well, when she said that I'd relapsed, I felt kind of ashamed about having taken the oxycodone again. But I was in a lot of pain.
Right. Yeah. So the thing, Braden, you have to remember is, while taking the opioids isn't a good thing, her problem is pain, and we have to help her with that pain. And once we help her with that, the opioid problem will diminish significantly. We also need to make sure that she understands that we, A, care about her, B, want to help her, and we're not judging her. So that's very important. And then we discuss maybe alternative pain relief methods, things that she can do so she's not using the opioids too often, but so that she is getting help with her pain. And then in long-term, semi-long-term, we have to also look at the fact that her sick time is being used up and she's got to go back to work because she's her family's sole breadwinner. So she's got a lot of different things that are on her mind that we have to help her address. So we can't just tell her we have to stop taking the opioids because that's not going to work. She's in pain and we have to help her deal with that, so she can't stop the opioids.
There are several areas for improvement in this example. The student's initial approach with the patient creates a judgmental atmosphere from the beginning, discouraging the patient from engaging in further discussion. As she stated, I felt ashamed when the nurse practitioner said I'd relapsed. The student continuously focused only on Diane's opioid use, despite the fact that the patient's primary complaint is her pain. The student could instead focus on addressing her pain first, especially as that is what prompted her visit. Providing the patient with alternative strategies for pain management would provide options not involving oxycodone.
Hi, Diane.
Hi.
My name's Braden Kamig. I'm a nurse practitioner student. I'll be working with you today. So I understand you're here for low back pain. Before we get into that, do you mind just telling me a little bit about yourself?
Sure. I'm a nurse's assistant at UPMC.
Oh, okay.
I hurt my back again on Friday night. I was walking my dog and tripped on the sidewalk, landed on my back. I was in a lot of pain. I mean, I think it's worse than it was the first time I heard it. And I had some leftover oxycodone, so I mean, it was just killing me. It was like 10 out of 10. So I took a few of those.
Okay, yeah, that sounds very hard. It's difficult to be in pain, I would imagine.
Yeah, it is. It's really frustrating.
Yeah. We'll try to get something worked out together if that sounds okay with you.
Yes.
So you completed the drug abuse screening test prior to coming in. We appreciate that. All of our patients fill it out. Do you mind if we go over the results?
No, that's fine.
Okay, so you screened a 4, which is at-risk substance use, probably related to the opioids that you've been taking for your pain.
Right.
So as far as cutting back and eliminating those, do you feel, how ready would you feel to do that on a scale of 1 to 10?
Well, like a 6 or a 7.
Okay.
I mean, I really don't want to be on medication, but I didn't think I was going to make it through the weekend unless I took something.
And it sounds like you've stopped using them before, which definitely will help. It's been successful in the past.
Right. The doctor told me after about 3 months that I had to stop, so it was hard, but I did it.
And how confident do you feel that you could stop taking these medications?
Like maybe a 4.
Okay.
I'm still in a lot of pain.
Yeah, so we'll have to figure something out that works for you.
Oh, okay, good.
Has anything helped with the pain other than these opioids in the past?
Well, the last time the doctor had me doing some physical therapy, and that seemed to help.
Okay.
Yeah.
Is that something that you would be willing to try again?
Yeah, I think so. I have to get back to work soon. My leave's almost up, but if I can...
Okay, yeah, that sounds very stressful.
Yeah.
So we can maybe do some physical therapy. There's also a pain clinic we could refer you to.
Oh,
Is that
okay.
something you would be interested in?
Sure, yeah.
Okay. In the meantime, as opposed to the opioids, we can try something called tramadol. It's a little bit stronger than Tylenol or ibuprofen or any of the non-inflammatories, but it's a little bit safer than the opioids. Is that something that you would be willing to try?
Sure, I'll try it if you think that'll help.
Okay, yeah, so we can try that. We can try physical therapy. I'll refer you to a pain clinic, and then we'll touch base, I would say, next week. I'll follow up and see how you're doing without the opioids.
Okay.
And we'll try to get you back to work as soon as possible with the pain resolved.
That'd be great.
Okay, well, it was nice meeting you, and we'll try to work on this together, and I'll follow up with you in a week.
Okay, great.
Thank you.
Thank you.
Hi, Ms. Smith. My name's Mike. I'm one of the instructors here, and I'm working with Braden this term. I wanted to thank you for allowing her to take part in your care, doing your assessment. Would you mind sharing with me and Braden how your experience has been today with your health care?
Well, I felt that she was interested in me as a person. She asked what I do for a living. I thought I had a lot of time to tell her what was going on and how much pain I'm in, and I felt understood. When she said that, it sounded like it was difficult for me. So I felt really comfortable talking to her about what was going on.
Great, thanks.
As you can see, the second example yielded a better outcome when the student took a more collaborative approach, paid attention to the pain reported by the patient, took the time to build rapport, elicit feedback, and discuss options with the patient. One of the key points of SBIRT is using a validated screening tool. Diane completed the Drug Abuse Screening Test, or DAST, which allowed the student to give unbiased feedback regarding her use. The steps to any screening process are to use a validated screen, introduce the subject, discuss the patient's score, and provide feedback. Isabella scored a 4 on the DAST, which indicates a moderate level of concern about her drug use. This was an example of the use of a readiness ruler. While the patient reported being a 6 on her willingness to change, she was a 4 on her confidence. The student was able to understand her point of view and help her to summarize the pros and cons of her opioid use and allow the patient to relax. With patients who are experiencing pain, it is effective to discuss with them what they have done in the past that has helped. The patient was able to stop using opioids previously, so it is important to obtain more information about that experience. The student demonstrated several examples of non-opioid alternatives to pain relief. For example, she recommended exercise, physical therapy, and a referral to the pain clinic. The student also recommended the medication tramadol, which is safer than oxycodone. The CDC's guidelines for prescribing opioids for chronic pain can be found at cdc.gov.